Welcome to Getting Understanding. For those of you who don't know, if this is your first time to the channel, I'm your host, Dr. Daryl Ellis. On today, I want to talk about andropause. What is andropause? Well, it's a name that we've given to male menopause. That is very much similar to what women go through that is called the change of life. In the case of females, and we've talked a little bit about this in previous videos, it's as a result of the loss of the ability of the ovaries to produce their reproductive hormones, specifically estradiol and progesterone. In men, however, it's a little bit different. In women, when they go through the change of life, they stop having menstrual cycles and they lose their ability to be fertile or bear children. In men, that's not the same case. With men, it's a decrease, a significant decrease in their testicles' ability to produce testosterone, the male hormone. It's the hormone that gives men their drive. It gives them their muscle mass. It gives them their aggressive nature in many cases. As we get older, we men that being the case, that ability to produce the testosterone decreases with time. In most men, that decrease becomes noticeable in their 30s to early 40s and can become symptomatic to a significant degree when you get in your fifth generation or your fifth decade of life or in your 50s. And what are those symptoms? Well, you end up having more fatigue than usual. You notice that you can actually have some foggy thinking or difficulty with brain fog, as we call it. Also, your libido or your sex drive declines. In many cases, men also notice problems with erectile dysfunction and loss of muscle mass, increased weight, particularly in the abdominal cavity, as well as difficulty with sleep, and in some cases, symptoms consistent with depression. It's a significant problem, and it affects virtually all men. So that's almost 50% of our population. So I think it's something that needs to be discussed. It's a topic that is relatively new in the medical literature, as we mostly focused on menopause in women and didn't pay much attention to men. One of the other symptoms and one of the other characteristics that differentiate andropause from menopause is like women, when they go through the change, they become hot. They have hot flashes, they have night sweats, and you hear about men suffering the ordeal of their wives having on air conditioning and fans and all kinds of things to help keep themselves cool, and the men are in there freezing. Well, it's not just because they've got on the air conditioning and the fans. One of the symptoms of andropause is just the opposite. We become much less cold tolerant. And some of it is as a result of those testosterone levels dropping, which decreases what we call thermogenesis, or your body's ability to generate heat internally. As your testosterone levels become lower, your metabolism slows down, and your ability to generate internal heat goes down, and as a result, you feel cold more often. If you have questions, if you want to know more about this specific topic, make sure you put us some comments into the comment section below. If you're not subscribed, I'd love for you to hit that subscribe button. Also hit the bell notification so that we can notify you when new topics are introduced. And lastly, I would love to hear from you in terms of additional topics that you would like to hear about. It's more important for me to talk about things that you want to hear about so that you can be informed, and than it is for me to just bring out topics that I think are important. Because ultimately, the purpose of this channel is to inform the public about medical issues that most affect you. God bless you.